Friends, good morning to all of you. Today, I would like to talk with you on a very important topic, Ayurveda and its medicines used in modern or conventional medicine. You can see that for convenience, I would like to split this talk in Ayurveda, medicines of Ayurveda, and its use in conventional medicine. The word Ayurveda is a Sanskrit word and a compound word. The entire text of Ayurveda is written in the Sanskrit language, which was the language of the talk and the use in ancient times. Now, the word Ayurveda is derived from the Ayush and Ved. Ayush means the life and Ved means the knowledge of life. This Ved word is by Greeks used as episteme, scientia in Latin, and science in English language. Thus, the Ayurveda is defined as the science of life. The question comes, was there any system prevailed in ancient times to take care of the health of the inmates of that period in the different regions? If you look back to the 𝐷𝐿 Samhita and 𝐴tharva Samhita, which is more than 5,000 years old, in which the different kinds of medicine in different diseases in the single form are used and ascribed. Later on, those plants which are enumerated in 𝐷𝐿, 𝐴tharva were explained with their properties, action and therapeutic uses in Charak Samhita and Susut Samhita during 1000 BCE. The same tradition continued, and in 𝐴sthāṅga, 6th century, the medieval period, the number of medicinal plants are enumerated with their synonyms, properties, therapeutic uses, and so on. Similarly, in Vrindamadhav, a good number of compound formulations, and in Amarkos, the single drugs with their synonyms are included. In modern period, Mahaprakash Nigantu, those plants are classified in different groups with their synonyms, action, properties, therapeutic uses, and also in different forms. Those knowledge ascribed in the different period of time are now present in Pharmacopoeia of India, which is basically in two forms, as I discussed earlier also, as a formulary in which the compound formulations are ascribed, and in Ayurvedic Pharmacopoeia, the description of single drug or plant, animal and other origin is seen. Coming back to the use of plant as medicine in India, India has a rich history of use of plant as medicine since ancient times. The first authentic reference is seen in 𝐷𝐿 in the form of Aushadhi Sukta, wise sayings on drugs. It is the first recorded reference in 𝐷𝐿. More use of valued medicinal plants are seen in Ayurveda, which includes plants of 𝐷𝐿 too. Following the tradition of 𝐷𝐿 and Ayurveda, in 𝐴𝐻𝐿 and 𝐻𝐿, a sizable number of medicinal plants with their rational use is enumerated. Those are the few plants which find place in 𝐷𝐿 and Ayurveda: 𝐴RK, 𝐻𝐿, Pipali, Palas, Vasa. In bracket, their scientific or botanical name is given to communicate the ancient names to the scientific world. Those same plants also find place in Charak Samhita and Susut Samhita. You can see the reference bracketed. The importance is that the same plants which are having place in 𝐷𝐿 and Ayurveda with the same name are find place in Charak Samhita and Susut Samhita. This shows that we have a strong tradition of use of medicinal plants since 𝐷𝐿 and later on in Charak Samhita and Susut Samhita. I will give you a few glimpses of the binomial nomenclature of Indian medicinal plants. I am into the medicinal plants which are used in Ayurveda. You can see that on your left side, the Sanskrit name of the medicinal plants are given like Arjun, Ashok, Karvi, Vasa, Jatamasi, Tamal and Nirgundi. On the right side, their scientific names comprising of the genre, species and author name. Terminalia is the genre and Arjun is the species. Now the species name is coined based on the classical Sanskrit name of that particular medicinal plant. Similarly, Ashok, Saraka Ashok, Karvi, Kairam Karvi, Vasa, Adatoda Vasica, Jatamasi, Nardo species Jatamasi, Tamal, Cinnamomum Tamal, Nirgundi, Vitex Nigundo. This shows that the beginning of the botanical nomenclature has also its roots from the classical names of medicinal plants ascribed in the Ayurvedic classics. This you can see that good number of names of the plant in Charak Samhita and Susut Samhita. In the center, their Sanskrit name with the different groups is given, like the first one below. In case of Charak Samhita, वीरण षष्टिक इक्षु बालिका दर्भ कुश कास गुंदेन्दु इत्कट तृणमूलानि इति दशेमानि स्तन्य जनानि भवन्ति. Means those 10 drugs which are enumerated there belongs to the 𝐻𝐮𝐸 or galactagogue promoting group of drugs. In such a way, the different groups were coined, and above that the reference of the Susut Samhita, where 𝐴RC, 𝐴LRC, 𝐾𝐿 and so on drugs are included in 𝐴RCADI GAN with their properties and action and uses after that. Now, coming to the Ayurveda as traditional medicine by World Health Organization. Earlier, before 2005, WHO included the medical system or the medicine used for well-being of the humanity called as a traditional medicine or complementary medicine or an alternative medicine, has its emergence in the different part of the world, different countries, and group them together to understand the different traditional medicine or complementary medicines around the world. Ayurveda was also put as traditional or not complementary or alternative medicine initially. After producing the evidence of the traditional Indian medicine by Government of India to the World Health Organization, WHO has accepted Ayurveda as traditional system of medicine of India, which has more than 5,000 years old tradition practiced in India from generation to generation and still successfully practiced throughout the country. Now, when we talk about the medicines of Ayurveda, we found that they are seen or they are available in the market in two forms: classical medicines and the proprietary Ayurvedic medicines. Now, the classical medicines are those medicines either in single form or the compound form ascribed with their details, their formation, their manufacturing, their properties, therapeutic uses like Chyawanprash, Triphala Churn, Das Mularis. These are some of the compound formulations, and when we talk about the single, you can see that Asugandha Churn, Haritaki Churn, Guduchi Churn, those are in the powder form of medicinal plants used in Ayurveda. But in case of the proprietary Ayurvedic medicine, the ingredients combination is not found in traditional Ayurvedic textbooks as found in case of the classical medicine. This is very important. Any company, any pharmaceutical industry makes the formula based on reasoning and expertise, conducts clinical trial about its efficacy in particular disease, gets license from drug control authorities and makes the medicine to introduce that in market. So, without that they cannot market them. This is the few pictures of the classical medicines. You can see different pharmaceutical industries. Dasan Sanskar Churn is a compound form, Asugandha Churn is a single drug powder, Bhratvad Chintamani is a herbomineral compound, Again, Rajapravartin is a compound formation. You can see also the Amla ki Rasayan. Those were the classical medicine based on the medicines ascribed in the Ayurvedic classics. But proprietary Ayurvedic medicines, as I narrated earlier, prepared by the different pharmaceutical industries based on their expertise, their clinical assessment, and then marketed for its wider use throughout the country. Now, those Ayurvedic medicines are prepared either as a single drug or in compound formulations, obtained the raw material from the plant or minerals and the animal origin resources. In fact, all the three natural drugs which are available in the nature are used in Ayurveda, not any synthetic drug. A proportion of natural resource in Ayurvedic medicines assessment was done, and it was found that the 80% of the plant origin drugs are used in Ayurveda and 10% each animal and mineral origin drugs. This may varies from the different scholars' view. The important is that the plant 80% plant origin. It is not only the plant substance is used to produce the drug, but also their juice, their decoction, etc. are used to triturate the animal and mineral origin to make them most absorbable form as absorbent through the different cells in the body. Now, looking to this, the use of medicinal plants throughout the world is increasing. The WHO and Life Science Division of UNESCO has reported that in developed countries, the use of natural resources as plant-based drug derived is increasing. This is very important. In Europe, about 1,500 species of medicinal and aromatic plants are widely used in Albania, Bulgaria, France, Germany, Hungary, Spain, and United Kingdom. The growing awareness on use of medicinal plants moved to the Chiang Mai Declaration at Thailand in 1988, where there was a slogan was given in that, saving lives by saving plants. If you want to use for the well-being of the mankind, the medicinal plant to be properly saved. In 40th World Health Assembly adopted a resolution reaffirming the Alma Ata Declaration, which was in Rio de Janeiro, given the two mandate to the WHO, comprehensive program on medicinal plants used in traditional medicine, and ensure quality control of drug derived from the traditional medicine. This is very important, that the protection of the medicinal plants, traditional medicinal plant, by the native country where traditional medicine is used in the form of the preservation of natural cultivation, natural harvesting, least use of the, rather no use of the different fertilizers to ensure the quality and efficacious plant medicine by the native country for their peoples. There were impression about that this plant which are used in Ayurveda have no scientific background, which is not true. This was initial observation in many years seen in the animals, and those experience obtained from the animals were further analyzed in human beings for their efficacy, quality, safety, even for their any toxic manifestation. Based on certain hypothesis was made and repeated examination, analysis of those plants, the basic principles or the concepts were made. Chief principles of Ayurveda, just to give you the few glimpses, like Pancha Mahabhut, 5 proto-elements, Dravya the substance, Sharir this body, those 3 bioelemental substances, Agni digestive and metabolic fire, Am endotoxin, Oj vital essence of life. Those concepts are beautifully defined in the classics and later on by the different scholars with their commentary, with their English edition, which are available. One can go through that. The ancient saints who started this science wrote the entire science of life in the manuscript form, and later on explained to their disciple, who further wrote different texts and communicated this knowledge from generation to generation in India. Now, those medicinal plants have shown their importance in modern or the conventional medicine. It is rough estimated that 25% of modern drugs are directly or indirectly derived from plant products. Means the different plants, knowing their properties, action and uses, were examined and the phytoconstituents were isolated, and that phytoconstituents in the form of the tablet, syrup and even injectable form were used or are used in modern or the conventional system. Some of the drugs which are manufactured today includes morphine, codeine, papaverine, quinine, emmettine, quinidine, digoxin, colchicine, caffeine, hyoscine, xanthotoxin, psoralen, sennaglycosides, L-DOPA, azmaline, strychnine, bromine, vaccine, etc. These are the few examples of the plant-derived drugs. Of them, a good numbers of from Ayurveda. Now, these are the plant drugs with their phytoactive constraint and their action in different system of the body. In the left side you can see their names in Sanskrit with their scientific names like Darvi, Berberis aristata, Haridra, Curcuma longa, Hritpatri, Digitalis purpurea, Madhuk, Glicyria glabra, Kutaj, Holarina antidecentrica, Parsikiavani, Hyoscyamus niger, Ahifane, Papaver somniferum, Sarpagandha, Rolfia serpentina, Sthonic Texas. These are the few examples which were taken up from the Ayurvedic classics right from Vedic period till today, seen in the text of Ayurveda. Berberine was isolated, looking to its activity as mentioned in Ayurvedic classics for its use in diarrhea, which is known as the Atisar in Sanskrit, and this berberine was used as anti-diarrheal agent, and the tablets were made available in the market in different parts of the country. The first one, Vasa, Adatoda vasica, Vesicine, was isolated and used as a bronchodilator. Curcuma from the Haridra, as well known for its anti-inflammatory activity. Similarly, the others, like Kutas, as its name is given, botanical or the scientific name, Holarina antidecentrica, and it was anti-dysenteric use is used isolating the cornicin from the bark of the Holarina antidysenterica. Taxol, Sthonic Texas baccata, which is called the Sthonic in classics, and used as an anti-cancer agent. Now I am showing you the glimpses of the pictures of those plants. This is Adatoda vasica. You can see the beautiful leaves along with an inset the picture of the flower, and based on the flower a name is coined as a 𝐻𝐿, means lion's mouth. You can see that the flower looks like the lion's mouth. This was an identifying feature of this plant, and from the leaves Vesicine, Vesicinol, even brucine is isolated and used in respiratory tract diseases. Berberis aristata, it's called the Daru Haridra. In inset you can see the pieces of the root and stem, which looks like the color of the curcuma or the haldi, and the wood which is like the haldi, Daru Haridra, is known as the Daru Haridra. The leaves along with the flowers, and berberine is isolated from this plant, which is apart from use as antidiarrheal, also used for the conjunctivitis. Curcuma domestica, haldi, the rhizome of that in insect is yellow in color. This is the unpeeled rhizome, but if you peel it, you will find inside it is yellowish in color. This is well known now throughout the world, and not only anti-inflammatory, anti-cancer, hypolipidemic, hypoglycemic, and it is exported from our country. This is Digitalis purpurea. You can see the blooming of the flowers. It is a high altitude plant. In Ayurveda it is known as 𝐻𝐿𝐵, though it is not seen in Charak Samhita, Susu Samhita, Ashtanga. Later on in Nighantus it is included. Mulethi, Madhuk or Madhuyasti, Yasti Madhu. In insect you can see the pieces of the root and stolon which are used, and glycyrrhizin is isolated from that and is used for the different purpose, even for the eye complaints in human beings. This is Hyoscyamus niger. The seed is there. You can see hyoscyamin is isolated from that and used in conventional medicine. Tulsi, Ocimum sanctum, or solic acid is isolated from that, which has shown anti-stress activity in clinical cases. This beautiful picture of the Papaver somniferum, which is commonly grown in the Afghanistan and other part of neighboring area of that. This is the fruits of the plant. You can see there is a incision over the fruit and black color oozing out of that. From that, morphine, narcotic analgesic, is prepared. There are many other codeine and other principles are also isolated and used in modern medicine. This is very important plant, Rolfia serpentina. You can see the insect root like serpent. The structure looks like the serpent. That's why it is called the Rolfia serpentina. And Sarpagandha in our classics. Reserpine isolated from this root, which has been seen the first antihypertensive drug. In Ayurvedic classics, it is usually prescribed for the person who is highly agitated or the violent. Looking to that, it was used to reduce the blood pressure and found effective clinically. Videnya somnifera, which is known as ashwagandha. You can see the insect root of that. This root is used in number of diseases as immunomodulator, strength promoter, as an anxiolytic to induce the sleep, as it is known as Videnya somnifera as its botanical name. The powder form of this, either with the cow's ghee or with the milk or simple plain water, is prescribed. Now this a number of glycosides, methanolides, has been isolated from this, and CSIR has published one book on this plant where one can find out the different active constituents in that. Texas baccata, Taxol, this is also a high Himalayan plant, and the leaves were isolated for its active fraction Taxol, used for the cancer, breast cancer. Apart from that, There are many other plants, this 𝐴𝐴𝐵𝐿𝐴, fruits of 𝐴𝐴𝐵𝐿𝐴, which is well known master ingredient of Chyawanprash. It is known as a precursor of the vitamin C, and apart from that it also helps in the DNA synthesis. I would also like to draw your attention on some of the commonly used substance as a dietary substance, daily use. They are also having high salicylate. That high salicylate block the vitamin K and act as natural blood thinner. You can see the ginger, the mint, the turmeric and chili powder. All those are the blood thinner, blocks vitamin K, which helps in the blood coagulation. So, if anybody is using those, should not use the blood thinner, or if using the blood thinners, should not use those dietary substances in their food. Garlic, another important plant of Ayurveda, which is known as the rason, lasun in classics. Garlic, which is well mentioned among etiological factor of bleeding disorder. Basically, it is considered as a hot in nature, and while using this, one should take precaution, because the bleeding disorder contains 9 different naturally occurring antiplatelets compound in this garlic. Apart from it is also natural antibiotic that can kill intestinal bacteria, which manufactures vitamin K. You can see that it is antiplatelets compound it inhibits the vitamin K formation, which is essential for the blood clotting. So, again, while taking the modern drugs, one should take care to use very cautiously. Fish in Charak Samhita, it is well known, reported as a etiological factor of the Rakta Pitta or the internal hemorrhage. It is fish oil is known as 3 fatty acids, omega 3 fatty acids, helps thin the blood. So, fish may be great food for people who are at risk of blood clots, but too much consumption of omega 3 can be at risk of bleeding disorder. Those taking this blood thinners again should take precaution as guidelines shown in Charak Samhita as etiological factor of the bleeding disorders. Now, just a few glimpses to you that why the medicinal plants is gradually taking up throughout the world. There was in Germany in 1962 thalidomide disaster has happened, when it was observed that 3,000 pregnant ladies, when delivered the babies, in them fish-like deformity was developed. This deformity, they when studied, found that it is due to the use of thalidomide during the pregnancy. So, this has also drawn the attention of the medicinal plants. The another is the Merck recall Vioxx heart risk found in arthritis drug. Means this is used for the arthritis, and in September 30, a huge number of patients were observed the heart risk, those who were using this drug for painkiller. Now, the medicinal plants which are got the importance in our country, their quality standard of medicinal plants, Indian medicinal plants, are enumerated in the publication of Indian Council of Medical Research, New Delhi, 2003, volume 1 and 17 volumes has come up. Most of the medicinal plants which are given in Ayurvedic classics are included in them with their identity, their phytochemical constituents, pharmacological activity, therapeutic uses, and so on. Now, standardization of those drugs as said by World Health Organization, while emphasizing the importance of traditional medicinal plant, standardization in fact employs the process, the procedure and method by which optimum conditions can ensure for obtaining predetermined result consistently. Predetermined result as mentioned in the classics, if they are formed as per the classics, the therapeutic efficacy which has been described in the classical literature should be obtained. That is the standard. And for that, the guidelines has been given in Ayurvedic classics when to collect the different parts of the plant which can help to form the different standard drugs. Leaves in rainy and spring season, summer and winter, the root in autumn, the bark, the tubers, the latex, and season specific, the fruit, the flower, because season specific is not constant. That all depends upon the flowering season of the plant, fruiting season of the plant. Based on that, those parts should be collected as guidelines given in Ayurvedic classics.